Hi medicos, today we are going to study about axilla. Axilla is an important essay in your first year. Okay, axilla, basically known as armpit in our normal language. Okay, it is actually a pyramidal space between the side of chest. This is chest, and it is a side of chest and upper part of arm. The space between these two is axilla. It is actually in pyramidal shape. Okay, remember it. It is a pyramidal space between the side of chest and upper part of arm. Okay, it is actually bounded by the axillary folds. This is anterior axillary fold. This is posterior axillary fold. I will say about the muscles that contributed for these folds a little later. Okay, these two folds bounce the axilla. Hope you understood. And it also acts as the funnel. For what? For neurovascular structures. Okay, it has lymph nodes which drain the lymph from the breast and upper limb. Okay, this is the introduction about axilla. It is basically known as armpit, a pyramidal space. Let's discuss its boundaries. As I told before, the axillary folds bound the axilla. Okay, they are anterior and posterior. These two axillary folds bound the axilla. Let's discuss about the anterior. This is the anterior axillary fold. Okay, this anterior axillary fold actually formed by the contribution of pectoralis major muscle by its lateral edge. Actually the both axillary folds are smooth by their twisting of muscles. Okay, this is anterior, and the posterior axillary fold, I mean this axillary fold is formed by the contribution of two muscles. They are latissimus dorsi and teres major. These two muscles contribute to the posterior axillary fold. Okay, in posterior axillary fold, latissimus dorsi twist around teres major. It is the reason for its smoothness. Okay, coming to the boundaries of axilla. Okay, as I told before, it is a pyramidal space between upper part of arm and chest, side of chest. I mean, okay. It has an apex. I mean boundaries. I'm saying boundaries and base and four walls. Okay, it is a pyramidal. Okay, pyramidal space. Okay, an apex and base and four walls. The four walls are anterior, posterior, lateral, and medial. Okay, this is the boundaries of axilla. Okay, this is apex. This is the base. It is actually from the posterior aspect, this picture. So we can see the posterior wall, the medial wall, and the lateral wall. You can guess it is of left hand side easily. That too from the posterior aspect. Okay, see, this all is axilla. Okay, it is apex, base, the anterior wall, and behind is the posterior wall, and the medial wall, and the lateral wall. Hope you understood now. Okay, this apex acts as a funnel through which the neurovascular structure passes from the neck to upper limb. Let's discuss about each boundary of axilla. Coming to the apex of axilla, a boundary of axilla. It actually acts as the passageway between what? Between the neck and the actual axilla. The passage between these two structures is apex of axilla. It is actually a triangular space. I will show its boundaries a little while after. Okay, we will discuss about its direction. Okay, it is directed upward and also medial. The resultant structure should be like this. Okay, it is upward and also medial. So the resultant is like this. This is the triangular space. As I told before, this is the apex of axilla. It is medially bounded by the outer border of first rib. This is first rib. This is the inner border. This is the outer border. This is the outer border of first rib. This is the and in front by the clavicle and behind by the scapula. That too, upper border of scapula. And through axilla, we can say the axillary artery and the brachial plexus. These two structures enter from neck to axilla. Also, one structure leaves the axilla to neck. That is from axilla to neck. That is axillary vein. It goes from axilla to neck. So, the apex is the passageway. We will discuss about the base now. Now, coming to the base of axilla. The base of axilla is actually the lower end of axilla. We can say that by seeing the diagram. Okay, it is directed downward like this. It is directed downward. The base is directed downward, while the apex is directed upwards and medially. Remember these two directions of boundaries of axilla. And the next thing is we need to learn about the boundaries of base of axilla. Okay, I have already told this picture is of posterior aspect. So we can see the posterior wall here. Okay, this is the base. Remember this picture as posterior aspect. This is the side wall of chest. Okay, and this is the part of upper limb. Upper limb and upper arm. Okay, this is side wall of chest, and this region is base. While this is posterior axillary fold, and this is anterior axillary fold. Hope you understood now. Okay, it is bounded by the anterior axillary fold and posterior axillary fold. Okay, I will show it once again. Remember, this picture is of posterior aspect of left hand. Okay, this is posterior axillary fold. This is anterior axillary fold. These two folds make the base hollow. The base is actually hollow. Okay, it is actually hollow. Okay, we have already learned that the anterior axillary fold is by the contribution of muscle pectoralis major. Okay, its lower border or lateral edge, we can say. The posterior axillary fold, I have said it earlier, it's by the contribution of two muscles. They are latissimus dorsi and teres major. These two muscles, by the twisting properties, make the posterior axillary fold smooth. Same happens in the anterior axillary fold. Okay, on the medial side, we have seen this is the medial side. This is medial, this is lateral, and this is the side of chest wall. This is part of upper arm of upper limb. Okay, this is base of axilla. Let's study about the four walls. The anterior wall is actually formed by the three muscles. They are pectoralis major, pectoralis minor, and subclavius. These three muscles form the anterior wall. Okay, and the pectoralis minor muscle, which is present here, pectoralis minor muscle, and the pectoralis. This is the pectoralis minor muscle. Okay, this all is the pectoralis major muscle, and also below the clavicle we have subclavius muscle. Here we cannot see it clearly. Subclavius muscle is there. Okay, subclavius. Okay, these three muscles constitute the anterior wall of axilla. We can see the posterior aspect. This is the posterior aspect. This diagram is of posterior aspect. Okay, of left side. Here we can see the subscapularis muscle and also latissimus dorsi and teres major muscles. Okay, these three muscles form the posterior wall of axilla. Okay, the medial wall is actually formed by the upper 4 or 5 ribs. Okay, the upper 4 or 5 ribs along with the intercostal spaces between them. Intercostal spaces are nothing but the spaces between the ribs. These intercostal spaces are actually covered by the serratus anterior muscle. So, we can say the medial wall is formed by the upper 4 or 5 ribs with including the intercostal spaces between them and also the serratus anterior muscle which covers the intercostal spaces. Okay, lateral wall. The lateral wall is actually formed by the tendon of biceps. This is the tendon of biceps in biceptal groove and short head of biceps brachii and also coracobrachialis muscle. These three structures form the lateral wall of axilla. As I told before, tendon of biceps brachii. Okay, that is present in biceptal groove. Remember this point. Okay. Another one is short head of biceps brachii. Okay, and also the coracobrachialis as usual. These three form the lateral wall. I will show it again. This is the tendon of biceps brachii present in the biceptal groove. This is the short head of biceps brachii. This is the coracobrachialis. These three structures form the lateral wall of axilla. And also this lateral wall is narrow because the anterior and posterior walls of axilla converge at this point. Okay, due to these two walls convergent, the lateral wall is narrow. Remember this point. The axilla contains the axillary artery. First I will write and I will show. First thing is axillary artery. And the next is the axillary vein. And also the axillary lymph nodes. I think it's easy to remember. And also the brachial plexus. A familiar word. Okay, especially its chords. And also the long thoracic nerve. Long thoracic nerve is a part of brachial plexus which supply the serratus anterior muscle. Okay. The intercostobrachial nerve. Also the fibrofatty tissue. And the last but not least, we need to remember, if you have seen the mammary gland, you will remember axillary tail of Spence. Okay, these seven structures or these seven contents are present in the axilla. This diagram is a superior view of apex of axilla. Here we can see some of the contents of axilla, like axillary artery. This is the axillary artery and axillary vein. This is the axillary vein. Okay, axillary lymph nodes. Actually, this axillary lymph nodes drain the lymph from the breast and upper limb, especially. Okay, brachial plexus, especially its cords. These yellow color structures here are cords of brachial plexus, posterior, lateral, and medial cords of brachial plexus. Okay, the long thoracic nerve and intercostal brachial nerve are not in the picture. Okay, the axillary talus pons. It is the extension of mammary gland which pierces the deep fascia and enter into axilla. Okay, if you have seen the mammary gland, you will remember. These seven structures are the contents of axilla. I think I am clear about the axilla, its boundaries, and its contents. Thank you.